stigma, discrimination, and invisibility. Trans people are stigmatized, they don't access health services when they are available, they often have bad feelings about themselves that mean that they don't take care of themselves the way that they should, they don't take care of their health the way that they should. They get into patterns of life which make it difficult for them to take care of themselves, and when there are health services available to them, they're often available under the rubric MSM, and there are not many transgender women who want to access those sorts of services. They don't think of themselves as men, they're not men. Transgender people need to get organized. As a community, they need to have a voice, use that voice, press for their rights. Rights which are in many places in Asia-Pacific are trampled on daily. More than anything, the right to recognition in their affirmed gender. Transgender women should be fighting hard for the right that they so richly deserve to have, that of being recognized as women. And trans men, that most invisible of communities within an already invisible community, they need to fight hard too. Well, that's easy for somebody like me to say. I'm not in the community. But I still got to say it. It needs to be done. There needs to be an end to the invisibility of the trans communities in Asia and the Pacific. WPATH is an immensely important organization. It's the only global professional organization concerned entirely with transgender health. It's an organization that historically has always had its meetings in North America or Western Europe, and yet it's an organization that increasingly takes a global perspective and a very broad perspective on transgender health. Here in Bangkok, over these last few days, we've had the very first WPATH Symposium outside North America and Western Europe, and it's been a superb opportunity for the global trans health community to learn more about the circumstances in which transgender people live in this region, their health needs in this region. I think that the presence of a large number of members of the trans community at this symposium has been immensely useful. It's fostered a dialogue, it's fostered a real enlightenment in the rest of the world amongst the people who so very greatly matter, that is transgender health workers. It's fostered an enlightenment about transgender health in this region. Already, on the day that the conference is closing, because that's the day that I'm speaking on, I'm hearing people talking about connections that have been forged between health workers in Europe and community members and their organizations in this region. It really does look as though there could be the beginning of a real dialogue, a developing working relationship, linking Asia-Pacific communities up with the rest of the world. It's great to see that this might happen. And it wouldn't have happened if not for this funded program which enabled so many members to come here to the symposium.